So if you've been told that you have problems with spinal stenosis, this video is for you. Hi, I'm Dr. Greg Gersten with Align Wellness Center, and I've been helping people to get back to the life that they thought they should for the last 20 years without drugs or surgery. Spinal stenosis, this actually came from one of the discovery calls that we do. If you're looking for help and you don't know where to go ahead and look in the links down below. What I do is I hop on the phone with people around the country to help them figure out what the next best steps are. And I did that with Anthony earlier this week, and he had been told that this is what he's experiencing and that he needed help immediately. He found us and realized that chiropractic biophysics is the right thing. But what spinal stenosis winds up being is that this is a segment of your spine. These are two of the bones, and then in between the bones are discs. Okay, when we wind up building our segments together, this is typically in the lumbar spine what they look like, and they go up and they go down. That's your lower back. When we look at it from the top, you can see there's a big yellow thing right here. That's the spinal cord, or the nerves that go through the spine to every tissue, organ, and gland in the body. Now, through life, typically through reoccurring low-level episodes or potentially high-level episodes of back pain, the spinal disc winds up degenerating and becoming smaller. As that winds up becoming smaller, the vertebrae begins to slip forward as a part of spinal degeneration, degenerative disc disease, or degenerative degenerative joint disease in the spine. As it winds up shifting forward, it can cause this spinal cord here to have less and less space to go through. That is what the stenosis is, when there's less and less space for that spinal cord to go through because it becomes compressed. As that's left alone, and as improper position of your spine is left over time, aka if you wind up having lower back pain and you just take Tylenol, Advil, or you just do some things to get out of pain, but you don't have the spine looked at to determine is it in the right position or the wrong position, then it allows for the spine to degenerate and break down and move further and further into that stenotic state. What happens, or how do you know if you're experiencing spinal stenosis? Most typically you'll have weakness in your legs. You can have bilateral sciatica or numbness and tingling down your legs. You can wind up noticing that it feels better when you wind up leaning forward. That's a common symptom of it. Typically an x-ray and MRIs are the ways to wind up diagnosing it. However, when you've been told that you have this, it's imperative that you get to someone who can wind up restoring proper position within the spine so that that spinal cord can have plenty of space to flow through and not be compressed. My medical colleagues will look at doing laminectomies to wind up helping with that. That means removing the back portion of your spine. Not always the best solution. So we've got to see if there's a non-surgical way to wind up correcting this, and the sooner that you wind up meeting with a corrective chiropractor to figure out the normal positions of your spine, the easier it'll wind up being. If you're wondering how to connect with one of those, go ahead and write down below. I do my best to help all of the people who subscribe to our channel and comment, provide them the best answers possible, or we hop on a discovery call like we did with Anthony to help him figure out his next best steps. And once again, my name is Dr. Greg, and I want to thank you for letting me be a part of your health.